some people believe that with snake bites you can suck the venom out.
With your mouth?
Yes.
Who says that?
People do.
Oh. Welcome back to our YouTube channel at the LyLu Health Talk podcast, where we talk about everything and anything health to do. And for today's podcast, we are going to talk about first aid and the importance of first aid and everything you need to know about first aid. We are delighted to be with our special guest. She's called Adela. She's going to introduce herself, and so please stay tuned and don't forget to like, share, and subscribe. Hi listeners, welcome back to our podcast channel. Today I'm delighted and honored to have a special guest. She's called Adela, and we're going to talk about the importance of first aid, like what people should know about first aid. She is a physician assistant, and let you introduce yourself briefly and before we start our conversation.
Okay, so my name is Adela. I'm a physician assistant, as she said, and I'm very excited to be here today to talk with our beautiful hostess about first aid. Yes, I'm looking forward to share more insights with you all.
Mm-hmm. You've had her. She's a physician assistant, and she works at the clinics. She's interacted with patients she interacts with patients on a daily basis, and she understands the importance of first aid. Like usually first aid is something that let me not steal your show. You're going to actually, the first question is for you to talk about what first aid is all about. Yeah. For people who in which this is probably their first time to hear about this concept. So in your understanding, what is first aid?
So first aid is basically the help given to an injured or sick person until a professional medical help arrives. So it basically is just the small things that you can do to a sick person until you call for help, until you transport the person to the nearest facility where they can receive more treatment. So basically that's just first aid. Yeah. So the help you can give to a sick person until a medical professional sees them.
Okay. Yes. And why is it important?
So first aid is important because it preserves lives. So you are helping the person to survive. Probably what happened to the patient, you don't know whether it's life-threatening. It could be a minor injury, it could be a major injury, a life-threatening injury. So you are trying to help the person to survive and not lose their lives. Yes. Yeah. And also we are trying to prevent injury. You are trying to do more good than harm. So you don't want whatever happened to the person to worsen. So you are trying to prevent that from happening. And then you are also trying to promote recovery. So you are trying to help them not to feel, if they are in pain, you're helping them not to be in pain. You are also trying to improve their time of recovery. Probably the help that you can give them to improve, maybe you shorten that time of recovery than probably if not doing anything, it lengthens the time of recovery. So that's why first aid is important. As much as you are doing all that, you also try to call for help, because it's first aid. It's not something that you can do on your own. So you are trying to call for help so that other professionals, medical professionals, can come in and then help.
Yeah. So from what you're saying, first aid is something that you do before somebody gets
a professional comes in.
And it's very important because you're shortening the period of recovery. So that somebody who have gotten first aid is different from somebody who have not, because you've done your best so that the patient gets to the clinic when they're in good shape and they can heal fast because of the medical practitioners' interventions. And what are some of the most common emergencies people face at home or in public where first aid is very necessary or needed?
So accidents can occur everywhere. I mean, at our workplaces, in schools, at anywhere, at homes, even as you are taking this video. I mean, something can just happen, then I might require first aid, or you might require first aid. So some of the instances where first aid will be needed include if in our homes, especially in our kitchens, burns. You can be cooking or doing something and you can have burns, which will require some Yes, I mean, with the ladies, I mean, men don't usually cook a lot, but the ladies that always
do cook.
Okay, of late though, now we are getting a lot of men chefs, so yes, that's fine. Yeah, and even at our workplaces, we use kettles and things at our workplaces where you can get burns. Yes, so burns, you can be eating and then someone can start choking. Yes, they may require first aid. You can just be somewhere doing something and all of a sudden a person can collapse. So they might also need some CPR, cardiopulmonary resuscitation, or chest compressions. Yes, so that's also very important. And also, someone can have a fracture. You can be having sporting activities, or even just walking or running or doing something vigorous. Nowadays, a lot of young people go to the gym and all that. They might have fractures or sprains. Yes, that might require first aid. Or maybe in breathing difficulties, some people are allergic to some things, or they are asthmatic, where they might also require first aid. So these are some of the instances where first aid is required.
Yeah, I totally agree with you. And it seems like, from what you're saying, first aid can be needed at any point in time.
At any point in time.
Anywhere. Even just like you've mentioned, even right now as you speak, I might collapse.
Yes,
and
I might equally collapse.
It's good we have you on the show. Like we have you right now because you're a medical doctor. But let's say I was talking to somebody who is not a medical doctor. That person is probably required to do something before help arrives.
Yes.
And so from what we are saying here, first aid is something that is needed from our day-to-day, because accidents are very inevitable. They can happen anytime, any day, and you will be mandated to do something unless you'll be mandated to do something. Otherwise, somebody will die. Yeah, and so this is to sort of prepare you to understand the kind of conversation we are having. We're talking about an important topic that you should know of. Everybody usually must know the essentials of first aid, like what you need to do when something happens. And so Adela is going to help us to uncover different things that like the basic essentials that we should be aware of, so that we are able to help in time of need. So I want to understand, I'm sure many of you know of first aid kits, and so I'm curious, like what should be in the first aid kit that every household or a student should have?
Okay, so first, I think our vitals are very important. Yes, so with a first aid kit, things like thermometer to check our temperatures, because as I said, vitals are very necessary. So a thermometer to always constantly, if you think I'm spiking or you're spiking, we just want to quickly check our temperature to know whether it's increasing or it's fine. So a thermometer is important. Then we have the BP apparatus.
What does BP mean?
Blood pressure. So a blood pressure apparatus, it can, some of them are there, you can use it to check your blood pressure, and it can equally tell your pulse. So in our homes, in our home settings like this, we have the elderly people that are there that we might constantly need to check their blood pressures and their pulses, because some of them are hypertensive, so it's very necessary to have that in your first aid kit.
And sorry to cut you, when we're still on this, like what's the normal BP or blood pressures measurements? Like, which one is a normal temperature?
BP. Yes, so usually they say the average blood pressure is 120 over 80 millimeter mercury, sorry. So that's the normal, but it's usually a range. So so if you get around that range, so from 110 to 120, and then from 70 to 80, that's fine.
Yes. And for the temperature?
So temperature is usually 36.
Mm-hmm.
Yes, 36.4 degrees Celsius. Yes,
Mm-hmm.
and then the pulse is usually from 60 to 100
Yeah.
beats per minute. Yes.
Yeah.
So those are the normal. Yes.
Yeah. And when we're still on this, when I was preparing for this podcast, I was looking at different. You see the vitals we're talking
Yes.
about, the likes of blood pressure and then temperatures. These are very essential things or basic things that one should check out for if somebody is having a hard time breathing or somebody is having an injury, any form of accident they've encountered. You have to check their temperature, because if the temperature is ridiculously high, it's affecting their body system, like the way the body functions. Some of the enzymes starts to collapse, and they are not able to do the chemical reactions that they are supposed to be doing. And so once the temperature is too high, so many things in the body are collapsing and shutting down. And so if you're not careful and do something to, maybe if let's say the person is very cold and you bring a bracket, you're helping them, because you're sort of making them bring their temperatures back to normal. Otherwise, the damage that is happening is very fast, and it might get to a point that the person gets the actual help when they are already dead.
Yes.
And so it's listen to what she's talking about of the temperatures and BPs, because these are like the basic things that you need to check before you start even giving help that you need to give. Yeah. And
so we also have in your first aid kit, we can also have a glucometer. A glucometer is just is a machine that we can use to check your sugar level, your glucose level. So as I was saying, we have a lot of diabetic patients.
Yeah.
Yes, so it's very necessary. Not only just diabetics do, but it's always necessary to check your sugar level sometimes.
Yeah.
Okay, and then we can also have plasters in your first aid kit, gloves. We can have gauze for
Why
dressing.
would I have gloves? Gloves is
for wound dressing. Probably you are dressing the wound, you don't want to get it infected.
Okay.
Yes.
Yeah.
So even though you might wash your hands, but it's still necessary to wear gloves so as not to infect wounds when you are dressing it. Yes. So gauze for dressing also. Then maybe bandages for other things. Yes. And then you can also have some medications, maybe some pain meds, like paracetamol, ibuprofen, yes, for pain. You can have burn gels, you can have antiseptic lotions for dressing wounds. Yes, you can have maybe diarrhea medications or medications for vomiting, or maybe some common cold medications. You can have
a whole pharmacy.
oh no, it's just first aid. Yeah, just trying to, relieve pain. Yes, before, they get to. It's part of first aid.
Yeah, I sort of get you. Like, it's a necessary inconvenience that you have to prepare for, because you never know what kind of first aid you provide.
Exactly.
Let's say you kept paracetamol and somebody is having serious diarrhea and you don't have medication for that. Like, what is your first aid kit for? So I think the more items you have in your first aid kit, the better you're likely to provide help when it's needed. And we are talking about instances where you're at home, like, because I don't think if I have a first aid kit, I'm not sure I'll be working with it on a daily basis. Like, I don't even know right now. Do you have your first aid kit with you? And so I think these are things that we can do it to prepare for emergencies at home or at the workplace. Yes. And so if you have a first aid kit, it's really good to, like, you have it in hand. It might save you. You might even get to save you yourself, like, in case it's your turn and you have people around who can be able to make the most out of your kit to help you. And so right now I want us to, like, discuss different things that you can do in different emergencies.
Okay.
Yeah. And the first one is what's the right thing to do if someone faints or collapses suddenly?
Okay, so that's a nice scenario, and it happens a lot, quite a lot. So let's take it that we are here right now, and then someone just collapses or faints or something. The first thing you want to do is to make sure that their environment is safe, because you don't know what's wrong with the person, you don't know why the person collapsed. So you don't want something sharp or anything that will cause harm, because you can remember first aid, you are trying to prevent other injuries. You don't want whatever that is happening to the person to worsen. So you are preventing other injuries. So you want to make sure that his or her environment is safe. So anything that might fall on them, anything sharp, anything that can bend them, you just want them to be safe. Yes. So that's the first thing you would want to do. Then you also want to assess their responsiveness. So after making sure their environment is safe, you want to call out their name. Hortense, are you awake? What's wrong with you? You want to see whether they are responsive, whether they are conscious or unconscious. Yes. So you are trying to assess that too as well. And in as much as you are doing all that, you are also trying to call for help, because you can't do it on your own. You don't know what's wrong with the person, and so you are calling for help. I know we are in Ghana, so I'll not say 911.
Our ambulance system don't work.
It does work, but it's not as effective as other countries.
So who do you call?
So maybe you can call other people around in case you want to transport the person to the nearest facility. So you start calling people for help, but you can still call the ambulance too. If they are around, then they can dispatch an ambulance to come and help them. They'll let you know. And then you want to assess the patient's vitals. You want to assess whether they are breathing or they are having a pulse, like their heart is beating. So you can put your hand just above their nose. If someone is breathing, then you put your hand that way, you would know. Or you want to check their pulse. So if you see that probably the patient is not having a pulse, then you want to check that again. So you would place your hand at the carotid vein. It's just right below.
Carotid?
Yes.
Carotid vein.
Yes.
Like right here.
Yes. If you place it, you feel it. Just place it. I don't know whether you can feel it.
Oh, I can.
Yes, exactly. So you'd want to do that and assess their pulse. If you can't assess any of that, then you want to start chest compression, CPR, as you are waiting. So you can start doing your chest compressions, and then you wait for help to come. And basically that's it. So if the patients come to becomes conscious during all that, then but it's still necessary to transport the patient or call for help so that professionals will be able to see the patient, because you didn't know what happened and the patient collapsed, so they have to be seen by a professional.
And the chest compressions, is it not the pumping of the chest?
Yes. So CPR is the chest. Actually, this side is going below. So the chest is somewhere here. Yes. So the chest is here. So you are trying to. The heart is somewhere here. So you are trying to. The heart is not beating, so you are trying to make it
when the heart is not beating.
Yes. So that's what it's only when the heart is beating that you can feel the patient's pulse. So when the heart is not beating, you can't feel the pulse. So that's when you start the chest compressions.
And what should someone do if they witness a seizure or a convulsion?
So a seizure or a convulsion, it also starts the same as someone who just suddenly collapses. So that person too. You see, with seizures, some people we call some things absent seizures. Like I can just have a seizure and then you wouldn't even know I've had a seizure. Like
you don't show signs at all.
Exactly. You are just then it will just come and pass without others even realizing. Sometimes you might not even realize that you've had a seizure.
You yourself.
Yes.
Hey,
but most seizures, like they come with jerking of the body, involuntary movement of the body. They are just shaking all over. So in as much as possible, you want to make them safe. You don't want them to, as I was saying initially, maybe something that is sharp. It might be by them, or they can be moving, checking, and then something can just fall on them, or they might hurt themselves on other things. So you want to make their space as safe as possible. I can remember an instance where he's a non-epileptic, right? So their farmers, so they went to the farm, and then I think that they were burning the bush, and then he had an episode. So when he had the episode, he just fell in whatever they were burning. at the back. So because of that, every part of his back got bent. So when he got to the hospital, he was just there for a very long time, and then he would just lie on his front. He couldn't sit, he couldn't lie on his back. He was whether he's eating, drinking, yes, because of the bends. So in as much as possible, we want to make their environment safe. Yes. And then because of the way they are jerking or they are moving, their involuntary movements, you wouldn't want them to hit their head too much. So you want to cushion their head. Probably if you have a pillow or anything soft that you can use to cushion their heads. Yes. So it's also necessary so that they wouldn't hit their head too much on the ground. Then if they are wearing any tight clothing, probably a tie or a shirt that is too tight or any dress that is too tight, you want to loosen it up so that it will help them breathe. And then you wouldn't want to restrain them to, maybe you see that the person is seizuring and moving the body and you are trying to restrain them. No, just allow them to flow. I don't know whether you but just don't restrain them, just give them the space to move or do whatever they're doing. And then
what happens if you restrain them? You're trying to hold them so that they don't hurt themselves.
Nothing. I wouldn't say nothing happens, but just it's not something that you can stop. Whether you restrain them or not, they are still having those check-ins. So just leave them. Yes, exactly. And then don't try to put anything in their mouth. So
because they can choke on it.
Not that they can choke on it, but just don't put anything in their mouth.
Okay. That's like a health precaution.
Yes. Yes. So that's what you can do for a person having a seizure. And then after they are done having the seizure, you would want to put them in a recovery position. So you would want them to lie on their side. So because sometimes when they are doing that, they accumulate fluids or saliva in their mouth, so you wouldn't want them to choke on that. So you put them on their side so that whatever is in their mouth can come out and then it can promote recovery. Yes. So someone with a seizure, basically that's what you can do. And then when they are done having the seizure, of course you have to send them to
the hospital.
Yes.
And speaking of choking, what can you walk us through what to do if somebody is choking?
Okay. So we have something we call the handlet maneuver.
Yes. Which is
so with this maneuver, if someone is choking, you'd want to stand behind them. You'd come and stand behind them, and then you place your hands on their abdomen, just directly below the rib cage. So maybe somewhere here,
below the breast.
Yeah, below the rib cage, yes, the breast. Then you apply pressure with your hands inwards and upwards, so that it's kind of like a jerking movement. You're applying pressure so that whatever they are choking on can come out. So the hand just right below the rib cage, and then you apply push inward
or
several times until probably whatever the person is choking on can come out. And then you can also try hitting their back. So as you are doing that, you can try hitting their backs too.
Okay,
it helps.
When they are lying down, right?
No, when they are standing.
When they are standing.
Yes. So doing that and then try hitting their backs too. It also helps with choking.
But for when you choose to use the arms,
yes,
and isn't the person supposed to be lying down?
No, the person is standing.
Okay.
So let's take it that you are hitting.
And then you go behind them.
Yes, you go behind them.
Oh,
yes.
I see. I couldn't imagine how to do it.
So you are standing behind them. So the person is actually standing. You are standing behind them. Then you are putting your hands on their just below the rib cage. Yes, and then you are applying pressure.
Yeah.
So you are checking movements to help dislodge whatever that is in their throat. Yes.
Yeah. I think that's good advice. Like me myself, I really had no idea what to do with such. But the demonstration helped.
Yes.
And how should people handle burns, from boiling water or fire or anything else? How are we supposed to handle burns?
Okay, so with burns, that as I said, it can happen anywhere, but most of the times it happens in our kitchens and stuff.
Yeah.
So with burns, you'd first want to cool the burn area with cool water, not cold water, just cool water, lukewarm water, or room temperature water. That's fine, but not cold water. So you just run the water on that surface for like a while, maybe 5 to 10 minutes or to 20 minutes. Then you'd want to just gently wash it with like water and some small soap, just gently, to remove any debris or anything, impurities from it. After that, you can just check to see whether there are any impurities. If they are not, then you can just apply. If you have like a burn gel or something, you can just apply and then use a gauze to cover it, and then you're fine.
Okay.
Yes,
It's that simple.
No, that's just with the minor burns. We are talking about what you can do at home, but with the ones you can't do at home, please
hurry up to the hospital.
Exactly. Once you applied maybe whatever, just using the water on it and just rush to the hospital. But the ones you can manage at home, after doing that, then you can just give the person any pain medication.
Like painkillers.
Yes, painkiller. Yes, the person will be fine. As I said, that's just the one you can manage at home. The ones that are too extensive or too deep, please rush them to the hospital.
You don't want to cause more damage.
No, we don't.
It's just reminding me what I used to do. I don't know if I want you to tell me if it's right or wrong. Usually when I get burns, I put oil. Like somebody has told me to apply oil.
Exactly.
But
we see that
feel so much pain. I'm like, the hell is this? Like this thing is not working.
We see that a lot. Like someone is having a burn and they'll be like, oh, apply this. You see, especially with our traditional setting, then they'll go and cut these leaves and they'll come and grind it together and then they'll put it. Oh no, that is going to cause infections. That's not the best. So just water, maybe if you have a burn gel, you can apply it, then the pain meds, and they just cover it up.
Okay. Yes. So like with a bandage.
Yes.
Okay. So that
you
avoid
infection. Yes. So with a gauze, then maybe if you have plaster, you can just plaster. Yes.
Yeah. Thanks for that. And what is the correct way to manage a sprain or a suspected fracture before reaching a hospital?
Okay. So sprains, we can get them from doing sports and activities, right? Or maybe just walking or anything. Yeah. So let's talk about the sprains first, maybe before we go to the fracture.
So you can maybe tell them what's the difference.
Oh, no, a sprain. Let's manage a sprain.
Yeah.
So if you get a sprain, the most common areas maybe on your ankle, your wrist, or anywhere that you have a sprain. In managing sprains, we have an acronym called RICE. Called RICE. RICES.
Hey.
Like jollof rice or fried rice. So RICE, yes.
Walk us through. What does
So
that mean?
R stands for rest. So let's take it that you were walking or you were doing any vigorous activity and you have the sprain. You would want to rest. Not that you just go and lie down and rest. No, that's not the rest. The rest here means you wouldn't want to put more pressure on the part that is affected. Probably if you were running and then you had a sprain, you just want to stop and you wouldn't put more pressure on that part behind you. So you are resting that part to prevent further injury. Then I stands for iced. So you are placing iced part. Maybe you wrap it around a towel and then you place it on that part. This helps with the swelling. It helps reduce the swelling. Yes. So you are doing that probably maybe every 2 to 3 hours. But it's very important that you wrap the ice around the towel or something. You wouldn't want to place the ice directly on your skin.
Okay.
Yes. And then C stands for compression. So you would want to stabilize the part. So you are using a bandage on that part so that you wouldn't want it to still be moving. Yes. So you are stabilizing that part of. If it's your ankle, you are stabilizing that part. So you use a bandage on it. So you make the bandage firm, but you wouldn't want it to be so tight. So you just make it firm, but not too tight. Yes, and then E stands for elevate. So you want to elevate the part that is to the heart level, so that it will help with reducing the swelling and the inflammation, and it will help with this. So this is what you can do for first aid in sprains. Yes. So that's what, as I said, that's what you can do. But if you do this for like 24 to 72 hours and then you are not seeing any improvement, then you would want to rush to the hospital. Yes, and then also you can take pain meds. Yes, so paracetamol, ibuprofen, any painkiller that you have, you can take it. And then if you are doing all that and still the swelling is increasing, you're still in so much pain and all that, then I'm not sure it's a simple sprain, probably it's a fracture or something. So you just have to like rush to the hospital. Yes, so that's what you can do for sprains. But with fractures, we can have open fracture and then a closed fracture. So if I say an open fracture, there's kind of like, you can see the flesh, the